1. Hand hygiene is only required when hands are visibly soiled. True or false? Answer: false. Rationale: hand hygiene is required before and after patient contact, regardless of visible soiling, to prevent the spread of pathogens and maintain infection control standards. 2. The right dose is one of the 6 rights of medication administration. True or false? Answer: true. Rationale: the 6 rights of medication administration include right patient, right medication, right dose, right route, right time, and right documentation, ensuring safe administration. 3. A nurse should delegate vital sign measurements to a certified nursing assistant, CNA. True or false? Answer: true. Rationale: measuring vital signs is within a CNA scope of practice, allowing the nurse to focus on tasks requiring clinical judgment, provided the patient is stable. 4. A bed alarm is considered a physical restraint. True or false? Answer: false. Rationale: a bed alarm alerts staff to patient movement but does not physically restrict the patient, unlike restraints such as wrist ties or vests. 5. The supine position is the best position for preventing aspiration during enteral feeding. True or false? Answer: false. Rationale: the head of the bed should be elevated 30 to 45 degrees during enteral feeding to reduce aspiration risk by promoting proper digestion. 6. A nurse should verify a patient's identity using only one identifier before administering medication. True or false? Answer: false. Rationale: 2 identifiers, e.g., name and date of birth, are required to ensure the right patient receives the medication, preventing errors. 7. Repositioning a bedridden patient every 2 hours helps prevent pressure ulcers. True or false? Answer: true. Rationale: repositioning every 2 hours relieves pressure on bony prominences, promoting circulation and reducing the risk of pressure ulcer formation. 8. A nurse can use clean gloves for a sterile dressing change. True or false? Answer: false. Rationale: sterile gloves are required for a sterile dressing change to maintain the sterile field and prevent infection. 9. The RAISE protocol is used in response to a hospital fire. True or false? Answer: true. Rationale: the RAISE protocol, rescue, alarm, contain, extinguish/evacuate, guides nurses in systematically responding to fire emergencies to ensure safety. 10. Throw rugs in a patient's home increase the risk of falls. True or false? Answer: true. Rationale: throw rugs are a tripping hazard, especially for older adults, increasing fall risk. Removing them is a key fall prevention strategy. 11. A nurse should assess bowel sounds by palpating the abdomen. True or false? Answer: false. Rationale: bowel sounds are assessed by auscultation with a stethoscope, not palpation, which evaluates texture and tenderness. 12. Alcohol-based hand sanitizer is effective for removing C. difficile spores. True or false? Answer: false. Rationale: C. difficile spores are resistant to alcohol-based sanitizers. Soap and water are required for effective hand hygiene. 13. A pink, moist stoma indicates a healthy colostomy. True or false? Answer: true. Rationale: a healthy colostomostoma is pink and moist, indicating good blood supply and tissue viability. Pale or dry stomas suggest complications. 14. A patient with dysphagia should be given medications one at a time with thickened liquid. True or false? Answer: true. Rationale: administering medications one at a time with thickened liquid reduces the risk of aspiration in patients with swallowing difficulties. 15. A nurse should document subjective data, such as patient appears anxious, in the medical record. True or false? Answer: false. Rationale: documentation should be objective, such as patient reports feeling anxious, to avoid assumptions and ensure accuracy. 16. Chest compressions are the priority action during a code blue for a pulseless patient. True or false? Answer: true. Rationale: chest compressions restore circulation in cardiac arrest, following ACLS guidelines as the priority life-saving intervention. 17. A gait belt should be used when assisting a patient with ambulation after surgery. True or false? Answer: true. Rationale: a gait belt provides stability and support, reducing fall risk during ambulation, especially for post-surgical patients. 18. A nurse can delegate medication administration to a CNA. True or false? Answer: false. Rationale: medication administration requires nursing judgment and is outside a CNA's scope of practice, ensuring patient safety. 19. Elevating a limb with a new cast helps reduce swelling. True or false? Answer: true. Rationale: elevation promotes venous return, reducing edema and discomfort in a newly casted limb. 20. A no smoking sign is required near a patient receiving oxygen therapy. True or false? Answer: true. Rationale: oxygen is highly flammable. A no smoking sign prevents fire hazards, ensuring patient and staff safety. 21. A nurse should clean a wound from the outer edges inward during a dressing change. True or false? Answer: false. Rationale: cleaning from the center outward prevents introducing pathogens from surrounding skin into the wound, reducing infection risk. 22. The vastus lateralis is the preferred site for intramuscular injections in adults. True or false? Answer: true. Rationale: the vastus lateralis has a large muscle mass and low risk of nerve injury, making it a safe and effective site for IM injections. 23. A certified medical interpreter should be used for patients with limited English proficiency. True or false? Answer: true. Rationale: a certified interpreter ensures accurate communication, reducing errors and promoting culturally competent care. 24. A patient's blood pressure should be taken with the arm below heart level. True or false? Answer: false. Rationale: the arm should be at heart level to ensure accurate blood pressure readings. Lower positioning can falsely elevate results. 25. A bedridden patient should be provided a pressure redistributing mattress to prevent ulcers. True or false? Answer: true. Rationale: a pressure redistributing mattress reduces pressure on bony prominences, preventing pressure ulcers in immobile patients. 26. A nurse should aspirate before administering an intramuscular injection. True or false? Answer: true. Rationale: aspiration checks for blood return, preventing injection into a blood vessel, which could cause complications. 27. A patient's intake and output should be measured and recorded every 24 hours. True or false? Answer: false. Rationale: intake and output should be measured and recorded more frequently, e.g., every shift, to monitor fluid balance accurately. 28. Deep breathing exercises are primarily used to improve digestion. True or false? Answer: false. Rationale: deep breathing exercises enhance oxygenation and lung expansion, not digestion, which is a secondary benefit. 29. A nurse should face away from a hearing-impaired patient while speaking to facilitate communication. True or false? Answer: false. Rationale: facing the patient allows for lip reading and nonverbal cues, improving communication with hearing-impaired patients. 30. A urinary catheter should be secured to the patient's leg to prevent infection. True or false? Answer: true. Rationale: securing the catheter prevents movement and traction, reducing the risk of urinary tract infections. 31. A patient's respiratory rate should be counted for 30 seconds to ensure accuracy. True or false? Answer: false. Rationale: counting for a full minute provides a more accurate baseline, especially for detecting irregular respiratory patterns. 32. A nurse should use open-ended questions to promote therapeutic communication with an anxious patient. True or false? Answer: true. Rationale: open-ended questions encourage patients to express concerns, fostering trust and reducing anxiety. 33. A patient with a nasogastric tube should have the tube's placement verified by auscultation. True or false? Answer: false. Rationale: auscultation is unreliable. X-ray verification is the gold standard to confirm nasogastric tube placement and prevent complications. 34. A nurse should use petroleum-based lubricants for nasal dryness in patients on oxygen therapy. True or false? Answer: false. Rationale: petroleum-based lubricants are flammable and unsafe with oxygen therapy. Water-based lubricants are recommended. 35. A patient with limited mobility should perform range of motion exercises to prevent contractures. True or false? Answer: true. Rationale: range of motion exercises maintain joint mobility and prevent contractures in patients with limited mobility. 36. A nurse should document only objective data in the patient's medical record. True or false? Answer: true. Rationale: objective data, e.g., measurable findings, patient statements, ensures accuracy and avoids assumptions in documentation. 37. The Trendelenburg position is appropriate for preventing aspiration during oral care in an unconscious patient. True or false? Answer: false. Rationale: the lateral position, not Trendelenburg, prevents aspiration by allowing secretions to drain safely during oral care. 38. A high-fiber diet includes foods like white rice and processed cheese. True or false? Answer: false. Rationale: high-fiber foods include whole grains, fruits, and vegetables. White rice and processed cheese are low in fiber. 39. A nurse should lock the wheels of a wheelchair before transferring a patient. True or false? Answer: true. Rationale: locking the wheels prevents movement, ensuring safety during patient transfers. 40. A stage 1 pressure ulcer is characterized by full-thickness skin loss. True or false? Answer: false. Rationale: a stage 1 pressure ulcer presents as non-blanchable redness. Full-thickness skin loss indicates a stage 3 or 4 ulcer.